The challenges of this lockdown was seized so beautifully by this team under the guidance of VP Ma'am, Asrani sir, Ajit sir, and Bhaskar sir and others, and all the other team members who work so tirelessly that we have really taken this platform to Zoom, Facebook, Instagram, and we're giving opportunities to so many presentations of cases, especially in this extremely difficult COVID times. Today will be a witness to one such experience that I'm sure will stand you in the long run in any aspects of your practice. I welcome you all. I want you to hear beautifully, patiently, and really with a lot of attention, because there's nothing like listening. Going back and reading PowerPoints really doesn't make a difference. And the live experience is nothing like. Now, a wonderful welcome to the extremely charming and beautiful Dr. Shobha. Dr. Shobha has been my colleague over 30 years now. I have seen her transform from an editor, a great practitioner, a passionate practitioner, and now she has taken homeopathy and made it a global force. Can you believe how hardworking she is and how passionate she is about our science? She has learned so many aspects of this science. She started her journey in the ICR. She went on to predictive homeopathy and now working on the HFF method and applied mind method. You can imagine the consistency and commitment of this learner to expand her knowledge. And not only that, I want you to welcome with a very, very warm, big applause, although we can't do it here, a writer and editor of NJH, over 100 articles, traveling an entire span from being an editor to becoming a leader and to help all of us as a team person. Please welcome Dr. Shobha to a wonderful experience that she's going to share with you. I'm sure you will never understand what she's talking until she shares and you listen to her very carefully. Please welcome Dr. Shobha. Thank you.
And with gratitude to all my teachers at NJH, ICR, HHF, and predictive homeopathy, that what I feel that being a homeopath, we all know that each patient coming to us are unique and they present to us with characteristics at the level of, at different levels, either at the level of mind or physical generals or physical particulars or pathology. So if we have knowledge of maximum facets of a remedy, there are less chances of missing out onto it, right? So let us learn the different facets of the remedy through this case. Now, ma'am has already talked to us about one facets of the camphora in the COVID cases. But today, there are the other facets I will be sharing with you people. And in this, we will be sharing it through the case. I will share it through case. What I have experienced is that through my study is that the camphor is a remedy which has lot of rubrics of delusion and delirium. That means this remedy is also useful in lot of cases where there is a brain pathology. Okay, so today I am going to share one case with you, which is again of a brain pathology. So this is a case of a lady who is a 75-year-old lady. And her daughter called me once saying that her mother has met with a fracture of a femur and she has been hospitalized and she has undergone a surgery. So, but during her hospitalization, the daughter has observed a very weird behavior in this patient with an irrelevant talk. Okay, so when I asked the daughter, she wanted me to go and see her. So I asked the daughter that what was it, but then she couldn't, she said, I am unable to understand and describe you that what exactly it is. So if I tell you about the patient has one son and one daughter. And the patient, the son is living in Pune and daughter is living in US. Whereas the patient was living with her husband in Mumbai. And her husband was a stockbroker who passed away before 6 months. So after her husband's demise, the patient shifted to Pune to stay with her son for some time. But it was only for short time. So after that, she did not like them much, and she preferred to come back to her Mumbai house. So that was the time, like, she kept telling her children, that like, for all these years I have lived a life as per my parents, then in-laws, then husband and children, but now that I am alone, I want to live life the way I want. And she was living her life very happily. So I knew her for past many years, the patient. She was a known patient to me. So the way I had known her, she was a very strong-willed lady. She was emotionally balanced. She was very loquacious and liked the company of people. Like earlier, I remember that whenever I had to talk to her, I had to call her up. It always happened that I would always think about, do I have a time, sufficient time? Then I would call her, try to talk to her, or try to go and see her, because she being loquacious and she liked the company so much that otherwise I would definitely sure that I would get delayed. So also she was a very religious minded, because she would not eat or drink anything till she visits the temple in the morning. First thing in the morning she goes and visits the temple. After that she eats or drinks anything. So this patient, she, after the husband's demise, she was staying alone in a big flat in Mumbai. Okay, and she did not like any dependency on the servants, although she had her cook and the servants as a visiting help coming to her. But she enjoyed her life. She used to do all her activities like reading, writing. She used to cook whatever she would like, she would love to eat. She was a very religious, she would watch the religious channels on TV. She would also watch the stock news, because the husband was in a stock market and she also had some knowledge about it. But she was enjoying her life and she was living her life happily, even though she was alone. Okay. In this, there was one setback in her life. What happened was that once she fell down in her home and she fractured her femur, right femur, the neck of right femur. So she was hospitalized, and she was her son came from Pune, her daughter came from US. She was hospitalized and she underwent surgery. But in the hospital also, like, she gathered herself so well that she stood up with strong willpower in a very short period of time. In the hospital itself, like, she cooperated with the physiotherapist and she walked very fast. Usually we have seen that in this age group of patients, because she was almost 75-year-old. So in that age group of patients, the patients, they are not very easy to do physiotherapies and to again stand up so easily. But this patient, she stood up very fast. So but the fracture brought little sadness to her, because she thought that now she will have to go to Pune, which she did not want to, because she was enjoying her life alone with her own self. And so when I went to see her, like, she was emotionally broken down. And she was now about the daughter's observation. What daughter had
What are you
told
going to eat?
us,
That's good. How much time?
and what daughter called us for. So what, even that was the daughter's observation. At the same time, even I had seen, when I took her case history, when I went to see her at her home after she came down from hospital, that what used to happen was that suddenly this patient used to talk something weird while, and this she used to do while talking, while sitting, while sleeping, while eating. Meaning, during any of her activities, she would suddenly talk something weird in between. And her talk was irrelevant to the talk which was going on. This talk, whatever she used to, was not in, like, it was coming up as if she was not conscious about it. It was coming involuntarily, without her realization and without her wish. So what I felt, and when I observed, was that as if suddenly while talking something, she's talking something, and suddenly she used to, like, go blank. She used to keep quiet, become, meaning, look fixed at some point, and she used to talk some sentence, and then again, for that fraction of second, she used to go off the track and then again come onto the track. So this is what was observed, and this is what I felt, that it was a trance in which she was going, like, as if she's eating something. Suddenly she would she would stand still, talk something, and in that talk she used to ask most of the things was about her mother, and she would ask, where is my mother? And again she would come back to normal within her normal activity. So this was something very strange. I also felt myself very lucky because when I could see that that thing happening in the patient, it was meaning at least I could understand what was happening, because otherwise for the daughter it was very difficult to explain. So she was speaking with that staring look for the fraction of seconds, and most of the time, most of the sentences that she spoke was either the same sentence or the similar sentence. And that those sentences she spoke many times during the day. And these sentences were like, "Call my mother, call your mother, tell my mother to take me. Where is my mother? Mother should come and ask, where are you? Call your mother to help me. Someone please come and call my mother," etc. These were the type of sentences which she used to talk. And the tone in most of these sentences was either of an anger or sadness or blank. Or she would get just blank and she would talk. So they were addressed to her, most 90% of the time it was addressed to her mother. When it was asked to daughter that since when have you observed this, the daughter said that it is since last 15 to 20 days that she's seeing that since the patient was in the hospital. Then then I tried to think that the patient who was very fine till like almost a few days ago, like till she met with the fracture, till that time like she was staying alone and she was enjoying her life, living happily. So what happened suddenly? Why she fractured her femur? I feel that nothing happens without any reason. So I thought, let me understand what is her stress and what is her conflict. So when I tried to talk to her, she told me in the during the case taking that she had a conflict with her nephew. Now, as we know that the patient's son and daughter was living away from her. So only the patient and patient and her husband were living in Mumbai. So this patient's nephew was meaning the husband's nephew, like he was their employee. Husband had employed him to do his stock trading business work and all, to help him into his business, all the bank related work or all the paper related work and all. And the nephew used to do this. But in this, suddenly, like one day, they realized that they met with a huge financial loss. And the family could not understand that what happened, meaning that why they suffered such a huge financial loss, because everything was going fine. So they did not understand whether it was because of the incapability of the nephew, because nephew was not intellectually a sharp person, or because he did some cheating, or what went wrong. So because of this incident, what had happened was that this patient of ours, she had lot of anger towards this nephew. She thought that it is only because of the nephew that we have suffered this financial loss. So but till the husband was alive, she did not do anything. She could not do, and she possibly did not voice out and kept quiet. But as soon as her husband passed away, after that, what she did is she took the charge in her hand and she terminated the nephew's job. And she was very harsh and bitterly talking about the nephew and getting angry onto him that how you lost my money. I want my money and I will recover it anyhow. So during the interview of the case taking, like what I saw was that this patient, meaning was completely a different person. What I have known her for years together was a very strong-willed, positive lady, who was, I thought, was an emotionally balanced. There was a time that when I had, before many years, I had given her Syphilitic, thinking about that. She was extremely chilly and emotionally balanced, thinking about that. But now here, during the case taking, during the interview, the patient was like absolutely, totally different side of the patient that I was seeing, which I had not seen her in all these years, because she was talking all with her anger and rage and all the bitterness towards the nephew. She was expressing it. So she said, I told the nephew also that I'm a bitter lady and you have become expert by digesting sins. So when she used to talk all these bitter languages, no, even the patient's daughter, that she used to do in front of the physician, in front of the daughter, in front of the nephew. The daughter used to, try to restrict the mother, saying that, mom, in US we call it zip it. That meaning she used to tell that, mom, zip your lips, don't talk such abusive languages. But the patient refused to the daughter and said that we Indians don't zip it and I am not going to zip it. So this is what was the case. And after a few days, like we did her MRI, and the MRI showed that there were many atrophic changes in the brain. So to sum up this case in a minute, if we understand the patient who was emotionally balanced, who was a strong-willed lady, who was very positive and living her life very happily, when she met with some setback in her life, there was a financial loss and she fell down and had fractured her femur, and had to be hospitalized. After that, all her delirium and all her meaning irrelevant talk and the behavioral changes started. Okay, so then now we had to treat this patient. So I wanted to understand that what is the pathology. So then the first thing was her atrophic changes in the brain, which was producing that irrelevant talk. So I tried to understand, and what I thought was the irrelevant talk, whatever was happening, was the delirium. Because if you if I again say, then what was happening was the patient was talking something. Suddenly she would get quiet. She would stare, and she would speak some sentence. Where is my mother? And again come back to normal. As if the feel that what I got was as if the train is going on a railway track. It is getting derailed for some particular fraction of seconds, and again it is going back on the train, on the railway track. So this is what was the derailment. That is what I felt, and that is what exactly is the delirium. The delirium is derailment of the mind, and this delirium takes the person away from the actuality and normalcy, which is against nature's law of survival, and which is a syphilitic expression. So I also thought why she met with the fracture, and why she met with the fracture of right side of the femur. So it is known that she had a conflict was with the nephew. So the conflict which is there usually either of with spouse or in-laws or some relatives or someone at workplace or in society, that is the time the patient suffers from the right-sided affections and right-sided pathologies. Whereas if the conflict is either with the immediate blood relations, either say with parents, siblings or children, then that is the time people or the patient suffer from the left-sided pathology or the affections. Okay, so then we thought of, okay, let us understand what we need to cure in this patient. Okay, so the patients, what we needed to cure was the deviated state of this patient, the deviated state of hers, her mind and body both, right? It was not only her delirious state, but also her bitter and abusive state, her shamelessness, her weeping, the way she was getting abusive and, she was getting her angry and the rage, which she was not there till now, whatever has come up. So this is also a diseased state because, see, as a human beings, we all suffer from all the types of the emotions, say fear, fright, anxiety, and say cheerfulness, anger, irritability. But do we every time take these emotions into our totality to treat the patient? No, at least not till it is responsible for producing some pathology or some disease. It is only at that moment of time that we take those emotions into our totality and we need to treat them. Till it doesn't become pathology, we do not need to treat them. So, now if we understand what is the dominant myasm in this case. So the dominant myasm in this case I felt was a syphilis. Because if we understand, see, this is the delirium of the mind, the fracture, the abusive and the bitter languages, which the patient did not understand that it was destructing her relationships. The fracture which had damaged and destructed the bones. Her shamelessness, which was like very much unnatural. Even daughter felt, that mom, you zip it. Daughter had to tell mother that mom, you please zip it. And the weeping, which I had not seen her weeping for all these years, the way she used to weep with this episode and with this pathology. So what I felt was that, a patient who was into a complete state of sora till now has directly gone into the state of syphilis. All these are the syphilitic expressions, all the expressions, the delirium, fracture, abusive languages, and shamelessness, weeping, everything, whatever was coming up as an expression was the syphilitic. So the patient who could not forgive her nephew directly went from sora to syphilis. Usually when we see the course of the disease, what we have experienced, what is there in our experiences, usually the disease travels from sora to psychosis and then syphilis. Whereas here we saw that disease has gone directly from sora to syphilis, skipping that psychotic state altogether completely. Okay, so now then I had to treat her. We had to take some rubrics and form our totality. So the first rubric that I thought was, first what I wanted to treat was the delirium, because the delirium being the most syphilitic thing, I thought I had to take some rubric related to delirium. And I found a very beautiful rubric in our repertory. Delirium repeats same sentence or words. And this is a single remedy rubric in complete repertory. In synthesis, there are two remedies in it. Whereas otherwise it is a single remedy rubric. In the complete only camphor is there, whereas in synthesis there is also plumbum, which is added along with camphor in this rubric. Because see, when we saw that 90% of the time the patient was repeating the same thing which was related to mother. Okay, and this was the similar sentences which she used to keep on talking many times during the day. The other rubrics which I thought of taking was the abusiveness, her shamelessness, her weeping incessantly, her escape attempts to. She did not want to stay at Pune. She wanted to come back to her own house. Okay, such a sudden manifestation, sudden because she had a sudden shock from the sudden financial losses. There was a sudden fall and she met with a fracture. That was also the sudden, and after that the manifestations of the delirium also started suddenly in her case. So there is a beautiful rubric in our generalities that disorders from injuries, blows, falls, bruises and oppressions. So this patient also had disorders after her injury, after her femur, after her fracture, and after she underwent the operation, right? So when I repertorized all this, the remedy which was covering completely through and through was camphor. Even though if we see that belladonna and hyoscyamus are coming in the front, but like they are not covering all the rubrics, they are just covering 3 and 4 rubrics, whereas camphor is covering all 7 rubrics. Then to understand that, I thought of, okay, let me now understand, let me now check whether her previous soric state, whatever we saw, is that also is covered by camphor. So the previous soric state that we saw, that, positive, vivacious, cheerful, happiness, tendency, religious affections, company desire, clinging, contradiction. So I tried to see and repertorize this, and what I found was that camphor was the remedy which was covering each and every rubric of this. Okay. So camphor 200 single dose was given to the patient, and let us see the remedy response. The patient's delirium started reducing in frequency and gradually it stopped completely within a month. And the patient was very much relaxed mentally. Her weeping had reduced, her energy levels were better. And the beautiful thing that happened is she could forgive her nephew. This is what was, even daughter came and told me that, she's been able to forgive nephew. She's been able to talk nicely with the nephew. She could forgive him. And she told daughter also to go back to US, and she agreed to go and stay with her son in Pune. And her abusiveness, her bitterness, her shamelessness, that also disappeared completely, to an extent that today it is 5 years. This is a 5-year-old case. But today, in all these 5 years, nothing of this has recurred. I know her, and she is in touch with me on a regular basis. Okay, so now let us understand what is camphor. So camphor is a waxy, flammable, transparent solid with strong aroma. And camphor, when heated, it directly goes into vapors. From solid, it directly goes into the vapors, skipping that liquid state. And that is exactly is the sublimation of camphor. That is why the camphor is known for its extreme reactions, and that is why what we saw even in the case, in our case, that it went directly from sora to syphilis, skipping that psychotic state, right? That is what was sublimation of the camphor. So now, friends, now we know the remedy, and when we know the remedy, and when we know that it has successfully treated the patient, you are sure and sure of the remedy. The best way to study this same remedy into more depth, I like it very much, and so I do this process in many of the cases and for many of the remedies. So what I try to do is I try to study its the rubrics of its mind, and try to understand its mind in a more deeper way. That is what I try to do even in this case, which I would like to share with you, because there are many single remedy rubrics in camphor, and if we try to see, then the single remedy rubrics are the rubrics which exclusively talks only and only about that remedy. So I feel they are very, very important, and it takes us very, very nearer to the simillimum in the shortest and the fastest way. Okay, so we should not meaning overlook the single remedy rubrics, even if they are just one single mark. And there are many other rubrics in the camphor. But those rubrics, if we try to just go through them, try to remember them, or try to read it out, many times we cannot understand or we cannot remember. But when we are doing this journey, because we have a case, and if we can correlate it with the case, then it becomes very easy. And if we try to understand those rubrics through metaphor, then it becomes even more easier and more nice to even understand those rubrics and understand the remedy, the depth of the remedy. Okay, so to understand the journey of any disease, which it has to have some causative modalities. So the causations which are there of camphor are, see, mental symptoms from injuries, accidents, and operation. Even in our patient, what we saw that her delirium has started after injuries, after the accident, after she had the fall, and after she had fractured her femur, and after she underwent operation. Okay, ailments from being alone. This patient was alone, living alone for 6 months. Last 6 months she used to live alone in her family. Ailments from anger, vexation, mortification, humiliation, and chagrin, that what she had, that anger and rage towards the nephew. Ailments from anticipation and fright and fear, which we are seeing in a lot of COVID cases. Ailments from shock. In this patient also, she had a shock after that financial loss, after she fell down and she fractured her femur, she underwent the shock. So after the causative factor, what happens is there is a loss of willpower. Every remedy has a breaking point, and it starts from that loss of willpower. Okay, so what happens to camphor is she loses control over his thoughts. All these are the rubrics that I am going to share with, I'm sharing with you all people. All these are rubrics of camphor in the mind chapter. There are a lot of rubrics of thoughts, fear, and anxiety into camphor. So camphor loses control over his thoughts. We saw even in our patient, absorbed, buried in thoughts, in higher, as if, but he is not conscious of them. See, the way we saw in our patient also, what had happened, the patient when used to go into that delirium, as if we felt as if she was absorbed in her thought, as if she was going into the higher plane, somewhere into the delirium, but she was not conscious about what she was talking, right? So it's a nice rubric that, absorbed, buried in thoughts, in higher, as if, but he is not conscious of them. Delirium, look fixed on one point. While talking, while being into that delirium state, she used to just become blank, and she used to, as if, she was just staring. That is what is looking fixed on one point. Then that is in the state of a delirium. Then delirium loquacious. Delirium loquacious means this patient is loquacious during delirium. If we see in the state of delirium, what used to happen to the patient is she used to talk those sentences. So that loquacity used to come during delirium. This patient of her, she was loquacious even in a soric state. But when we take the soric rubric, then it is a big rubric, and there are a lot of remedies in it. But if we take the syphilitic rubrics, the delirium location is comparatively a smaller rubric. And when we take the syphilitic rubrics, because that is the time it can take us very much nearer to the simillimum. So what I prefer is that, or I recommend is, we should take all this, try to take all the syphilitic rubrics. That means all those things which are very much unnatural, which are like, very much uncommon, which are perverted, which are having some behavioral problems. These are the type of the rubrics which we should take for our totality, which would help us to reach the simillimum in the fastest and the most shortest way. Okay, another rubric is delusion, specters, ghosts, spirits she sees. Now, this is because what is delusion? Delusion is perception of the patient, whether it is actuality or it is not actuality. The patient feels that it is an actuality. Here, it is the patient's perception. She feels that she sees spirits, ghosts, specters. She feels that the way she is talking in her delirium with her mother, possibly she feels that she's been able to connect with her mother because of the sublimation state of the camphor is able to connect with the spirits. Okay, the another rubric is delirium repeats the same sentence and the words. Very beautiful. Another rubric is trance, plays on piano with closed eyes, writes letters in an acquired language. What is this? See, the patient had gone into that state of trance. Now, what is playing piano? The playing piano and writing the letters is, what was she talking during that delirium? But was she talking with the closed eyes? No, her eyes were open. But when she was going into that delirium, for all practical purposes, her eyes were closed because eyes were open, but she wasn't conscious about it at all. Okay, so if we see, then in that sense, her eyes were closed. And what is acquired language? It is the language which we are not using in our day-to-day language. It is the acquired language which we have brought from somewhere, which we have acquired from somewhere. So that is the so her talk in her delirium state was something which she was acquiring from her delirium, and it was not her day-to-day language. That is why it was an acquired language. So that is how the trance plays on piano with closed eyes, writes letters in an acquired language. This is also a single remedy rubric of camphor. If we try to understand this rubric, otherwise it is very difficult. But if we try to understand in context with the case which we have treated and in context with the metaphor, then we will be able to understand this rubric very well, and we'll be able to apply it in some other cases also in very nicely. Another rubric is looking into the mirror aggravates. Now, what is mirror? Mirror is something where we see our own reflections. Now, when patient has started getting all those bitter thoughts and anger and rage for the nephew, she could understand her own thoughts, and possibly that is the time patients, they do not like to see their own reflections into the mirror, and that is why looking into the mirror aggravates. Company aversion to and desire for solitude. She did not like the company. Even when she went to the son's house at Pune, they had the son, daughter-in-law, his 3 children, and the maids. So many people were there, but then she did not like there, and she desired for her own solitude. She wanted to come back to Mumbai and stay with in her own house all alone. Okay. So then this rubric, I think, which ma'am also spoke, the delusion world, she has her own little, in which things are clear. The outside is uncertain. Our patient also, she felt she was very comfortable in her own house. She did not want to go to Pune. She did not want to step out of her house. She felt she was very happy in her own house. And this is exactly what we are seeing even in COVID. That stay home, stay safe. If you go out, you are uncertain about getting the infections. Okay. Then what happens? How the camphor patient adapts. Camphor patient adapts by hiding or by escaping. The patient also escaped from the Pune and tried to come and stay to her own home. And what are the reactions which we can see of the camphor patients is shrieking for help, abusive, insulting, lewdness, shamelessness, and destructiveness of clothes. So what happens to clothes? clothes give us, protects us, it helps giving us warmth. The patient, what happened, like patient was talking such a bad and destructive language for the nephew, whereas the nephew was helping her in the absence of her children. Cursing and swearing, curses desire to curse. Naked wants to be, and naked wants to be bears breast in Pupil mania. Now, what is this? Like, what I said when I went to her home to take her case, what I felt, the feeling that I got was that this patient, she had broken all the barriers, and the way she was expressing out, the way she was talking about her anger, rage, abusiveness, the way she was telling about the nephew, meaning she had no barrier. She did not think whether it is she's telling in front of a physician or whether her daughter is there or the nephew is there. She did not, she completely opened up herself and she spoke about all her bitterness. This is what is naked wants to be. Okay. So there are some important characteristics of the remedy which we can remember so that we can apply it in many cases. And first thing is the sublimation, that is solid to vapor, skipping the state of liquid, and that is what is seen in even in the pathologies, going from sora directly to syphilis, skipping that state of psychosis or tubercular myasm. The patient doesn't go the way we see the diseases traveling from sora to psychosis to syphilis and then tubercular and then syphilis. No, in this type of cases, the myasm travels directly from sora to syphilis. The collapse cases that we saw, collapses at both the levels, at the level of mind as well as body. Even in this case, what we saw that the patient, after she got the fracture and she went into that delirium state, that was a complete collapse of her, from that sora to syphilis state. Her system completely broke down. She used to weep incessantly. She became angry with rage and abusive and all that. And even in the COVID cases, we have seen, those cases which were the earlier videos which we saw, which had come from the Iran and the other countries, that, there used to be the collapse, that the people used to literally, patients used to literally collapse, and there used to be immediate collapses, the sudden manifestations. All this, usually the pathologies, this happens suddenly. It develops very suddenly. This patient also, she got a sudden financial loss. After that, she suffered the sudden fracture and then the sudden deliriums which started. Okay. And the chili yet uncovers is the contradictory modality of of camphor. Okay. So, thank you very much. Thank you, everybody. I end my presentation and my sharing with this. Thank you all.